you don't have to become an expert on each of these technologies. What's important is that you understand how they can be used effectively to treat or to manage their chronic conditions, to help gather data, and just be open to the idea that information can be collected outside of the office visit.
Welcome to Living Real Change, a podcast from Piedmont Healthcare. I'm your host, Dr. Lacey Knight, Chief Health Information Officer here at Piedmont. Join us as we highlight the people, the stories, and ideas that are transforming care and strengthening communities across Georgia. From inspiring patient journeys to expert health advice, each episode offers insight, hope, and a closer look at what real change looks like in healthcare today. It's January, which means many people are thinking about the year ahead and asking important questions about their health. How can I build better habits? How can I improve my fitness? And how can I better manage chronic conditions if I have them? Today, we're joined by Dr. Mabra, a primary care physician with Piedmont, to talk about the growing role of wearable technology in healthcare. From smartwatches and activity trackers to medical-grade tools like continuous glucose monitors, wearables are giving patients and physicians access to health data beyond the office visit. In this conversation, we explore how these tools can support prevention, personalize care, and help patients better understand their health day to day. Dr. Mabra also shares practical guidance on using wearables thoughtfully, setting realistic goals, and avoiding unnecessary stress around health data. I wanted, at least from your words, just have you explain, what does wearable mean to you? And if you want to separate kind of the consumer stuff from the kind of clinical grade stuff, that'd be great to hear about that too.
Yeah, so wearable devices are basically, as they say, technology that you can wear. Now, in terms of, consumer devices, you think of things that will help you monitor anything from activity level to your blood glucose. Then there are other devices that physicians may ask you to wear to track your heart rhythms, things of that nature. So all of those things are very important for helping us to get data points, to notice patterns that we need to recognize in order to make healthcare decisions. Well, really what it comes down to is that wearables provide us with a lot of information that we would not get to have in an office visit. And I think that's important for continuity of care.
That's awesome. How often do you have these types of conversations with your patients?
I think more and more often. I find that I particularly have these conversations with particular subsets of patients, like diabetics, who are having problems with adjusting their eating habits or even adjusting their insulin. And so I oftentimes recommend getting a continuous glucose monitor as a way to help them track what their blood glucose is doing. And they have found it to be very, very helpful. I think other people would prefer to use items like activity trackers instead of just randomly trying to figure out how they're doing in terms of their working out and their lifestyle changes. So I oftentimes will recommend activity trackers for lifestyle changes when I'm trying to get people to lower their blood pressure or just to improve their overall health. So those conversations are coming up quite often, particularly during annual physical exams, when I have the opportunity to talk about diet and exercise.
It seems like a great time to incorporate it. We won't get super technical into this, but just wanted to at least talk about the types of things that maybe we're hearing about people using. So activity trackers, I know a lot of people know about the watches that combine, it's primarily a watch, but includes other types of things as part of that. There are other things that are simply just wearables that are not oriented around taking time, but it's things that you wear in your wrists. There's some other things that show up as rings or patches. Is there anything else that you're familiar with that I may have missed?
That covers a lot of it. So there are sensors that can monitor your heart rate and your oxygen saturation. There's the ring, as you alluded to, that can measure sleep patterns. activity levels, heart rate, body temperature, and even respiratory rate that can potentially help those who need assistance with detecting sleep disorders. There are versions of the smartwatch that are designed primarily for epilepsy patients to detect potential seizures as well as send alerts to loved ones. There was one company that I was reading developed a non-invasive sensor to provide cuffless blood pressure monitoring. And then, of course, you've heard about wearable EKGs, and that was really transformed and the remote cardiac care. It's enabled users to detect atrial fibrillation earlier, allowing for timely intervention and the prevention of complications. I even read one sensor that tracks your sweat. And interesting enough to see, yeah, I thought that was interesting in terms of activity level, but also in terms of patients with cystic fibrosis, where understanding their sweat and the components of their sweat is an important aspect to managing their care as well. So these sensors, these devices, they're being used in many different forms for many different reasons. And I think that we're just on the cusp of greatness with wearables. I think their future holds a lot more possibilities and a lot more user-friendly wearables, and certainly wearables that are going to be important for helping primary care physicians as myself see a picture of what's going on with the patient outside of the office.
I love that. One of the things that I know I've talked to different folks about is the idea that if you have something that you're trying to improve and you're just relying upon a few visits a year with your doctor, it may not be enough information. And it sounds like these wearables do give you a
Absolutely.
lot of insight into what's happening between doctors' visits, and physicians like yourself are increasingly accustomed to having conversations and using um, some direction to help patients kind of start down this pathway.
Absolutely. I think the wearables are great for continuous care. Both the patient and the doctors can manage health over time and not just during these visits. You're allowing the patient and encouraging the patient to really self-monitor, and patients become more inclined to be proactive rather than reactive. So there's a stronger emphasis on prevention and early intervention. So I really like that aspect of it. Also, it allows for more personalized care. It's not just a one size fits all approach to medicine. That data, along with other information about that patient's risk factors and past medical history, allow us as physicians to tailor their therapies. So I think it's a very important tool to be used along lines with traditional healthcare tools to allow for better health outcomes.
So I like what you'd said about the prevention piece. It sounds like this kind of category is really great at giving insights that might otherwise be missed. And I know one of the popular things that we've seen people talk about, really the ability to help promote good habits and behaviors. Um, when you are, let's say, the patients that you're seeing this month, if they're expressing an interest in getting either better insights or getting some help supporting some of the behaviors that you've asked them to implement, how do you recommend that someone get started?
Well, the first thing for me is commitment to wearing the device, right? That's always an important piece to it. I think that focusing on consistency is truly important for the success of wearing these wearables. There's often a lot of excitement when someone first gets a wearable device, but that excitement can fizzle out before the benefits are realized. So instead, commit to wearing the device daily rather than being so driven by the numbers. Commit to making sure that it's a part of your daily routine. See it as a tool, as an opportunity rather than an obligation. And I think that's an important concept. If you can really wrap around that, then it can be used for the things that it really was intended to be used for, tracking activity and giving us data points to help us see patterns to make better decisions for our health.
Okay, that's interesting. So it sounds like almost the first thought from your perspective is really just get a baseline. Is that accurate?
Yeah, get a baseline and also make sure that you really understand that the numbers that you're seeing are not the whole picture, right? They're just presenting us with some information that we can add on to what we already know about your past medical history and about what's happening with you from a chronic disease perspective. So I think that's important because patients oftentimes can get a lot of anxiety surrounding these numbers that they get from wearables. And I guess that would be one of the downsides to it. You know, people sometimes get fixated on these numbers rather than seeing the overall pattern and understanding how it can apply to their particular chronic conditions, to their goals for lifestyle changes and diet management. So I think it's important to, yes, have that baseline and then see how those metrics are changing over time. It's important to have an awareness, but you don't want to increase anxiety by fixating on the numbers.
At Piedmont, quality care changes lives. Meet Tom, a lifelong medic who suddenly suffered a stroke at home. Tom was diagnosed, treated, and in surgery within minutes, thanks to seamless coordination across the entire care team.
I've seen firsthand how every second counts. When I needed help, Piedmont moved with speed and precision, and that saved my life. A week later, I was back at home with my family, back to work and back to living.
Hear more at piedmont.org/qualitycare. Piedmont, real change lives here.
I think most of the folks that are going to be listening to this today are maybe in the category of people that may not have kind of chronic medical ailments that they're managing, but they're interested in improving habits, activity, maybe better understanding of sleep. So I want to ask, and you may not have a perfect answer for this, but I want to ask for those folks that do not have a kind of a medical condition to tie this to. We'll talk about that part maybe a little bit later. How do you recommend establishing goals? I wear a smartwatch myself. I know when I first got it, it had set a goal for activity calories per day. I was kind of wondering where that came from. And sometimes, the number goes up, the number goes down. But do you have advice for how to establish goals or even how to manage the goals that come with the devices when you're just starting out in light of what you just recommended?
So my baseline recommendation for everyone, whether they're wearing wearables or not, is to get in 150 minutes of exercise a week, right? That's what our goal is. Now, I tell people to be realistic about their goals. You're not going to, if you've been sitting in sedentary for, several years, you're not going to necessarily jump up and be able to do 150 minutes of exercise in a week, right? So it starts with simple changes, and you can track that with your wearable. For instance, I told a patient the other day, you may not be able to do 150 minutes of exercise right now, but simple changes like parking further away from your job in the parking lot or from the entrance to a grocery store allows you to get more steps. Those steps can be tracked by your wearable device. Making sure that you have, you understand the recommendation for water intake and using your wearable to track how much water you're getting on a daily basis. So while you may not have chronic conditions, we all can improve on our activity level. We can all improve on our diet. And certainly these wearables are built for providing us with reminders, ways of tracking the minutes of exercise that we're doing. And I think that goes a long way to meeting our goals. So I would say, understand what the recommendations are, set realistic goals, and take baby steps and use the wearables as a reminder and as a way to track our progress over time.
I love the way you answered that question. So I had asked you how to set goals with Wearable, and you said, appropriately corrected me and said, you set the goals independent of the wearables. You use the wearables to help you understand how you're achieving those goals. I think for the moment, let's switch gears and talk a little bit about some of the medical grade wearables that you've been talking about. For a moment, if you could just explain, let's talk a little bit about the CGM or continuous glucose monitor. If you could explain what that is and how you've been using that in your practice.
Absolutely. So again, one of the most successful examples of how patients have used wearables to improve their health have been through these continuous glucose monitors. So continuous glucose monitors provide real-time glucose levels without the need for finger sticks. And diabetics love that part of it, right? Because it can be a painful thing to stick your finger or prick your finger on a daily basis multiple times a day. So they've helped diabetics make informed decisions about food choices and insulin adjustments. And what we're seeing is actually reductions in hospitalizations because they're not having these out of control numbers, glucose numbers, both high and low. They're able to make the adjustments before they need to seek emergency care. So again, technology really showing itself to be a very helpful tool to changing health outcomes that we didn't have several years ago, where we had to deal with people coming to the hospital with these outrageous numbers because they just didn't know what their glucose numbers were, or they weren't able to track it or intervene early enough to make a difference.
That is a really neat story. Is this something that I don't know who gets this and who doesn't, but how do you decide which types of patients are best suited for that type of tool?
Honestly, particularly people who use insulin, I always try to recommend a continuous glucose monitor for them. I often recommend it for my elderly patients who may have trouble either getting access to the equipment or the materials they need to check their blood glucose, or it becomes a very big burden for them to do so. I find that the continuous glucose monitors, which oftentimes only need to be changed out every couple of weeks, is very helpful for them. And a lot of them have gotten very savvy with either using a mobile phone to get their numbers or their results, or many of these devices come with sensors that provide the numbers that they need. So I think that anybody who's taking insulin we should definitely be recommending glucose continuous monitors. People who are struggling to maintain their glucose levels outside of that may want to consider doing a continuous glucose monitor mainly for people who need to check their glucose over several times in a day.
I have a question for you about data because I'm imagining a scenario where someone's on this continuous glucose monitor. They're also using something to track activity because with diabetics, you'd also want to make sure that they're exercising and active. Maybe there's a component
Sure.
about sleep. For someone who's really gone into this very far and they're collecting a lot of individual data, what's the right way, or what is the best way for a patient to kind of bring this information to their physician so that it can make sense to you? I know that um, you don't necessarily want, if you're seeing somebody every 3 months, you do not necessarily want to see 3 months worth of days of every single glucose measurement and every day's.
Right.
What's the right way for patients to kind of bring these new insights to you to help you direct their treatment?
The first thing is what you mentioned, is to bring it to your physician, right? Do not try to just interpret these numbers on your own. I think that's very important. I don't mind if my patients bring their actual monitor with them because many of the monitors will have summaries for 90 days or 30 days. So we don't necessarily have to look at every day individually. We can look at some of the summaries to help us guide changes in treatment. I think it's important, though, also to make your PCP aware of any patterns that you've noticed in terms of either hypoglycemia or hyperglycemia before the 3 months. If you're seeing a pattern, you don't have to wait until your next 3-month appointment to reach out to your physician to say, hey, I may need some changes in my regimen. So that's an important way to look at it as well. And we have messaging. We have many ways of contacting your PCP at Piedmont. And so I always encourage patients to take advantage of those methods to get in contact with me before the 3-month appointment or for further out.
There are very likely some physicians that are less familiar with these types of tools than you are. Do you have thoughts on, and obviously it seems like this is kind of the wave of the future. Do you have thoughts on how broadly people can get educated on these types of tools, what they can do, or you have recommendations on it?
This is a way to appropriately use AI, right? To get some of this information. Certainly, there are more medically focused AI engines like Open Evidence that can help you have a better understanding of how these technologies work. And I also would want to say that you don't have to become an expert on each of these technologies and know every last detail of them. What's important is that you help patients understand how they can be used effectively to treat or to manage their chronic conditions, to help gather data for treatment plans, and just be open to the idea that information can be collected outside of the office visit. But I also would say you need to keep checking back because the information is growing and we're learning more and more about the capabilities as well as the limitations of wearable devices.
Thank you for that. And then the final thoughts that you'd like to share with our group on really anything that we've talked about today?
I just wanted to share my own personal story. The other day I got a message that my steps were down compared to 4 weeks ago. And I was taken aback by that, but it had been the holidays. So let's keep that in mind as well. But it also was a good reminder that I needed to get back up to doing steps and moving more. And so I wasn't discouraged by it. I was actually encouraged by it because I realized that it's not meant to be a picture of my failures, but rather an opportunity to improve on what I did today, tomorrow. And so I want to encourage everybody to let it be just that. Let it be something that encourages you to improve on your health today for better results tomorrow.
Thank you for listening to Living Real Change. To hear more stories from across Piedmont Healthcare, be sure to subscribe and watch for upcoming episodes. For additional health tips, news, and resources, visit us at piedmont.org/living-real-change.